South Africa's daily tally of confirmed COVID-19 numbers has come down significantly. That's infections since the worst of the third wave around late June and early July. At some point, the country was recording over 20,000 new cases in a single day. Now infections are often below the 15,000 mark every day. However, the number of deaths reported on most days this week has been about 400. Professor of Vaccinology at Wits University, Shabir Madhi, is with us to try and make sense of the number of fatalities that we're seeing in the third wave. Prof, grateful for your time. Thank you for being on Newsfeed PM. Is the number of deaths, which has for most days this week and in previous weeks been about 400, proportionate to where we are in the wave?
Very much so. And the major reason for that is the reason the numbers have come down is because the wave has subsided significantly in Gauteng, where a quarter of the population live. Unfortunately, for a place such as the Western Cape, the number of cases is actually still increasing. And that's really a bad sign because we expect the number of people that end up in hospital and that die of COVID to lag behind by about 2 weeks compared with where the wave is at a point in time. So we're still probably going to see significant increase or at least high rates of death take place for the next few weeks until the Western Cape, KwaZulu-Natal, and one or two of the other provinces peak. So in Gauteng, we're in a relatively good space. The pressure on our healthcare services has also subsided quite significantly, but unfortunately that's not the case for the Western Cape, and probably even less so for KZN. KZN probably is the most worrying at this point in time because they still seem to be at a relatively early stage of this current wave.
And correct me if I'm wrong, Prof, the other issue with the reporting of COVID-19 data, yes, we get daily updates, but when a statement comes out and says there are 479 new COVID-related deaths, as happened last night, that is not necessarily to say that 479 people died of COVID-related complications on that day, correct?
Correct, because sometimes there is delays in reporting to national from the provinces, which might affect the day-to-day numbers. And that's the reason why it's more important to look at the 7-day rolling average rather than the daily numbers that are reported. And I think also we need to remember that for many provinces, except perhaps the Western Cape, there's significantly under-ascertainment of the actual number of people that are dying of COVID-19. The excess mortality data from the MRC indicates that the number of reported deaths is only about a third of the number of deaths that have actually taken place. Western Cape being the exception in that the number of reported COVID-19 deaths and excess mortality for the Western Cape is very, very closely aligned, but certainly not so for many of the other provinces, including KZN.
I'm glad you bring up the South African Medical Research Council and the data it's been keeping on excess deaths. It's now said in the latest report that I saw last night that we're seeing a drop in excess deaths among the over 60 age group. This was in the period from the 25th to the 31st of July when vaccinations began to gather pace. And you wonder then broadly for the population how much speed the vaccination drive would need to gain to see those benefits.
Absolutely. And although we're still not where we should be with the over 60s, we've just vaccinated about 2/3 of them now. That's vaccination of the over 60s is going to have a significant impact on this current wave as well as for the future waves, because previously people over the age of 60 constituted more than 50% of all people that were dying of COVID-19. So I think it's great that at last we're able to get them protected. It puts us in a good space should we experience another resurgence. But now the focus needs to be to ensure that we get higher levels of penetration in people above the age of 60, as well as anyone above the age of 35, and particularly those that have got underlying comorbidities. We need to be in the region of about 85 to 90% of people above the age of 35 being vaccinated, and that will put us in a good space when we experience the next resurgence in a few months' time.
And why didn't we, Prof, vaccinate people with comorbidities first? And how much do you think that's cost us?
Well, there was an issue when it comes to security of vaccine supply, which seems to have improved recently, especially with the donation, as an example, from the United States via the COVAX facility. So I think the issue of security of vaccine supply was an impediment to being able to scale up to other age groups. But now that that seems to have been addressed, certainly absolutely no reason for us to ensure that anyone with a comorbidity above the age of 18 But again, particularly people above the age of 35 are vaccinated, and those opportunities now do exist. Unfortunately, I don't think there's been adequate mobilization of the communities to ensure that people come forward to be vaccinated. I was at Kusani Bereguana's hospital this morning, and the vaccination clinic essentially was empty, which is really, really, truly disappointing.
Should we not open up vaccinations to the 18 to 34 cohort early then?
Well, we can, but it's not going to be of much meaning if we don't focus our attention on those people that will usually end up in hospital and die, and that is people above the age of 35 with comorbidities and above the age of 60. So vaccination of the 18 to 35 age group is also important. I'm not trying to dismiss it, but it can't come at a cost of mobilizing people above the age of 35 in particular to be vaccinated as quickly as possible, because they then make up about 85–90% of all of the hospitalizations that take place. And our focus with vaccines is not about getting to herd immunity, which is never going to transpire, but rather our focus of vaccines is to ensure that people are protected against severe disease and death. So we need to also, whilst we need to be inclusive as to who we offer vaccines to, we also need to ensure that we mobilize those individuals that are at highest risk of ending up in hospital and dying.
Why aren't the most high-risk groups showing up to vaccination centers, even though they have been prioritized and the messaging for over a year has been that in order to save most of their lives, this is what's needed?
Yeah, unfortunately, it comes to an issue of communication and advocacy. A lot of attention at the early stage of the rollout of the vaccine was to encourage people to register on EVDS without actually getting people to understand why it's important for them to be vaccinated. So I still think a lot needs to be done when it comes to community mobilization, when it comes to communication, when it comes to sharing the right type of information to impress on people as to why, even though we might be, this particular wave might be subsiding in Gauteng as an example, we're certainly not out of the woods. So communication is essential, mobilization of community organizations, NGOs, the religious organizations. We really need to put more effort on that. And that has been something that our response to COVID has probably lacked right from the outset. And that is involvement of anthropologists and other non-healthcare workers to basically get messaging through to the right people at the right time.
Professor Shabir Madhi, good to speak to you. Thank you so much for your time. The professor is with Wits University speaking to us about COVID-19 fatalities in the country.